For starters, I think it's the best kept secret in medicine. So MLS stands for multi-wavelength system. MLS Laser and Laser Therapy is different to shockwave because it uses light energy. Inflammation or a muscular tear, sprains, it's used in cancer care, cancer pain. With using light energy, it's incredibly effective and it's fast. And it's safe. Developing these different devices for many years, but the technology stays the same. So being able to deliver this energy at such high power so safely is quite remarkable.
Hello.
Hi, Nick.
For those who don't know, Lissa is a specialist in MLS Laser. And the reason I brought you on, I had a tear in my right knee and my right shoulder, and we connected through a friend of ours, Catherine. And you came and treated me for my tears in my knees and my shoulder. And over a period of 2 weeks, I saw a massive reduction in inflammation, pain, and just general improvement in well-being. Could you explain exactly what MLS Laser is? It's a bit of a mouthful. But I'm a massive fan. I thought I'd bring you on so you can share it with the world.
Thank you. For starters, I think it's the best kept secret in medicine because it's an innovative advanced technology that uses light energy. So MLS stands for multi-wavelength system, and that is laser. It's a cold laser device, but it's a medical device. And what makes it so different and high-tech is that it's got two synchronized wavelengths that are specific to treating inflammation, edema, biostimulating, and for pain relief. So the MLS is a patented technology developed and engineered in Italy by pioneers in laser. Lissa Laser is the company. And it is, like I said, it's a patented technology that delivers two synchronized wavelengths. And with that technology, we know by scientific evidence, it's the ideal combination to get that healing response by triggering the body's healing response.
Is it very similar to shockwave therapy? And I've done that before, where you go to a physio and he or she will use a device that basically taps on your knee very hard. It's painful. And the more painful it is, apparently the better result. And I've done that multiple times and I'm sitting there almost in tears, but you've just got to endure the pain. Is it very similar to that, where it basically breaks down not the cartilage, but the gunk in your knee or your joint to help heal it? Can you share exactly how it works?
Sure. So with shockwave, I've never had it done before, but from what I hear. So no, MLS laser and laser therapy is different to shockwave because it uses light energy. Shockwave isn't light energy. So shockwave has wavelengths that are usually a 905 nanometer, which is specific to pain relief because it's analgesic. It's an analgesic. But with laser or MLS, it's light energy. So we are not causing any pain. It's completely painless. With not all lasers are painless, but MLS is non-invasive. So it's completely safe. There are no adverse effects. It's safe in all injuries. So whether it's inflammation or a muscular tear, sprains, it's used in cancer care for cancer pain.
How's it used for cancer pain? Can you elaborate on that?
Sure. So because we're stimulating the body's natural healing response, we're also providing pain relief. So particularly for patients who are struggling with lymphedema, with cancer care after radiology, unfortunately, the post effects or the after effects of cancer treatment usually presents with lymphedema. So with lymphedema, it's basically a compromised lymphatic flow in the body. And so, those toxins do build up. So it causes inflammation, it causes edema in the body. So with MLS laser, we're triggering body's healing response and we're providing pain relief naturally.
From what I've seen before, lymphedema is it basically expands your limbs. So basically your leg will go from a size 48 to size 32 to a size 50. It really just expands the limbs. Is that correct?
That is
I know
correct.
it's a terrible way to explain it,
No,
but I've just seen images of it and
yeah.
I can't believe what I see.
It can be very debilitating. And, usually you'll see, how you describe is usually because
That's the worst description I've ever had. But what I'm trying to say is it makes your legs and limbs look larger.
Yeah. So the nearest lymph nodes in that area will be compromised. So they'll either be removed because of the cancer, the radiology that the individual's been exposed to. And basically what it means is because the lymphatic system isn't working at its best ability in that area, you can appreciate that the toxins aren't being filtered effectively. So with MLS laser, we encourage that lymphatic flow. With manual lymphatic drainage, the MLD, which is what lymphedema nurses provide or practitioners, that's what they usually.
Is that a massage?
Yeah, it's like a massage, but it's a very light massage, and there's quite a technique to it. Even that can be quite limiting in terms of providing treatment for and relief for these patients. So, with using light energy, it's incredibly effective and it's fast and it's safe.
I think I had 6 treatments over 2 weeks, and I didn't feel any pain at all. So I questioned whether it was actually working.
Yeah.
And the first treatment, I'm like, oh, is this a scam? But then I got a little bit of pain relief after the first treatment, and then I did it again, and there's more pain relief. I'm like, okay, maybe there's something to this. And it's purely just light on a particular part of my body for, I think, 5 minutes.
Yeah. So
that was it?
It can be between 5 to 15 minutes. Yeah. If you're treating the whole body, obviously you would need a little bit more time, but MLS laser is quite fast. They've been developing the different devices for many years, but the technology stays the same. So being able to deliver this energy at such high power so safely is quite remarkable. It's a medical device, so there is quite strict rules in Europe called the European MDR regulations. So MLS does satisfy those regulations. It's a medical device. It's a class 4 high power. However, you can't cause thermal damage, so you can't cause a burn. Yeah. It's quite safe. So in saying that, I think that's why I say it's like the best kept secret in medicine. We're not causing pain, and in this case, there is no gain in causing pain with laser, with MLS laser. It's phenomenal that it's mind-boggling to think that we're still quite behind in Australia in using this technology. Yeah. It's being used all around the world, especially in Europe, especially in the world of sports. There are professional top athletes being treated by this technology. And, I'm based in Melbourne, as you are, and we happen to be in the sports capital of the world, and yet our practitioners aren't using this often enough. And it should be available to everybody, whether you're a professional athlete or amateur, everyone.
I hadn't heard about it until I met you, obviously. Can you talk about some of the ailments and injuries and things you treat?
Sure, yeah.
So obviously you've got knee injuries, but I'd love to know exactly what you treat.
Yeah.
And what results have you seen?
Me personally, I've seen incredible results. And, I talk about it every day to practitioners who are using the laser or want to know more about the laser. But then when I see the results in clinic, it's just a reminder of how amazing it is. It's, it's so innovative. So there's pretty much everything you can treat. So bursitis, arthritis, muscular tears, sprains, inflammation, anything that's causing pain. So if you have pain, you will get pain relief, obviously. I've mentioned the cancer care, cancer pain, craniofacial pain as well. So excellent in TMJ or TMD disorder.
Let's talk about bursitis. So someone who has bursitis may do a cortisone injection, which gives them instant relief. If they use the MLS laser, what's the time period they can see a potential pain relief from it?
Interestingly,
Yeah.
cortisone is probably not required.
I hate cortisone. I think it's the worst thing on earth.
So in the event that someone were to get, if you were to get cortisone injection,
Yeah.
it's recommended that you don't intervene with the MLS laser for at least 2 weeks. And that's just so because I guess that's what the research gives us.
Yep.
It's recommended that you don't use MLS laser straight after
Yep.
using cortisone. However, it's one of those things where cortisone isn't always required when you have the MLS laser. So the scientific evidence behind it is showing that the MLS is proving to accelerate the healing and pain relief. So more often than not, the cortisone isn't required at all.
So as an example, I've had multiple cortisone injections in my shoulder. Yes, it gave me pain relief, but then it actually made the issue worse long term. If I do an MLS laser, how many treatments would I need to see great results? Is it 1, 2, 3, and over what time period?
Yeah, so with an acute injury, you can expect up to 8 treatments to complete a treatment plan,
Yep.
a cycle of treatments. After the first treatment, you will notice significant results. So whether that's pain relief or a reduction in oedema or inflammation.
Yep.
In chronic, expect up to 12 treatments. However, everybody is different. Every injury is different. So it's important to be consistent with this technology because you have to remember we're not using medication. We're not using pills. We're not being invasive.
Yeah.
It's relying on we're triggering the body's healing response with light energy, and takes time. It's like with the inflammation, the body's natural inflammation.
Yeah.
We allow that process to happen to then fight the inflammation. So it's the same with laser energy in the sense that we are relying on the body to respond to the light energy and heal itself.
So if I have a chronic injury and I do 8 to 12 treatments, for example, over what time period? Is it 2 weeks, 3 weeks?
It will depend, but generally the advice is 3 treatments in a week.
Okay.
If you can do more, then great. But in the real world, I think, most of us wouldn't get to a clinic more than 3 times a week. So twice a week is fine. But I think it's important to note that consecutive days isn't really required. Yeah. So you would allow at least 48 hours in between treatments. So 2 treatments in a week, up to 3 treatments a week.
Yep. Okay. You mentioned earlier that you treat people with lymphedema.
Yes.
And how soon can someone see results?
With lymphedema, the results are instant. You will see instant reduction in the swelling, in the oedema. I've seen patients describe the feeling as, the fluid is moving. So they usually describe that they can feel the fluid is moving.
Yeah.
Sometimes they rush to the bathroom because they need to go to the toilet, which is a really good result.
Why is that? They need to go to the bathroom.
It's because of the lymph is removing toxins, so it's stimulating, your kidneys and the whole filtering of the body. So it's trying to expel.
Got you. Okay.
Which is what we want.
Yeah. And when you're treating someone with lymphedema, sorry, trying to pronounce it, do you go up and down the entire body part, or do you take a particular position and just focus in that area?
That is dependent on the practitioner.
Yeah.
However, we have seen with clinical results that there's no right or wrong, but it's probably most effective to work towards the nearest lymph node.
Gotcha.
But because it's light energy, we don't have to be so specific, and we don't have to, worry about whether we're treating wrong, because it's, again, we're exciting those cells. So once you excite the cells, you're delivering that energy with light, and the body will, use the energy the way it needs to.
Gotcha. Do you think laser has a bad rap generally?
Yes and no. I think the general outlook is laser is dangerous, and There are very dangerous lasers, of course. It
Can you
can
name
be.
them?
Absolutely.
Yeah, please.
The one in skin aesthetics, they're quite dangerous. You know, what we use in skin resurfacing for skin rejuvenation. You know, like your CO2s, even your YAGs for hair removal. They can be very dangerous. But when you're using those correctly, they're incredible. Like the laser technology is remarkable. We're so lucky that we have that available to us. But it's important to understand the difference between lasers and the different wavelengths and how it's emitted. So with high power and low power, you know, we can deliver safely. So we just need to ensure that we're using the right protocols and we're delivering. We're using safety eyewear, for example. So with laser, it's one of those things where people think of laser being a cutting laser. MLS isn't a cutting laser, even though it's high-powered. It's a Class 4 laser, so usually that is quite a dangerous laser, but the patented technology that MLS it delivers it very safely, so you don't feel any warmth or any heat, and it's impossible to burn anybody. So you could hold it in the one spot and you do not have to move the laser handpiece to avoid thermal injury. So that makes it very unique to any other cold laser.
Do you think someone that's just had surgery, for example, they've had, let's say, surgery on their knee or a tummy tuck or facial surgery, do you think they should do MLS?
It is a huge advantage to have that post-surgery. There's an incredible orthopedic surgeon in the US, Dr. Scott Sigman. He's an orthopedic.
Say that 10 times straight.
He is amazing. I haven't met him personally, but he's a huge advocate for MLS laser. So he's an orthopedic surgeon in the US, and he's been on TEDx talks and explains the MLS laser and the science behind it with the photobiomodulation, and even links it to. He explains it really well in terms of. He starts with photosynthesis and then photobiomodulation, and then he talks about MLS laser. And he has got the MLS laser in his clinics using MLS in post-surgery and for perioperative care. So that could be pre and post-surgery care. And the results are remarkable.
Really? Why would you do a pre-surgery?
Preparation of the area to enhance healing. And also it's got that biostimulation effect, and also there's that pain relief as well. So we've got to remember that we're triggering the body's natural healing response. So any intervention with MLS is always beneficial.
Are there any risks with MLS?
No.
Not one. So there's not one thing that can happen that could potentially harm someone?
In pregnancy,
there's always something, Lissa.
In pregnancy, there's an absolute contraindication with MLS laser, and that is because it's never been tested. It's never been tested in pregnant women. Over an active tumour, it wouldn't be recommended. However,
why is that?
Because it's got that biostimulation, so we don't know whether it's going to cause any. Yeah. It's safe to use in pacemakers, not directly over the pacemaker. Metal implants, it's completely safe to use over the metal implant. You won't be causing any thermal injury or heating up of the tissue. So,
is it safe with kids? And what age group? Is it from babies up, or is it?
Yeah, it's safe in all ages. With children, it's recommended that you avoid the growth plates of joints, for example. So if you were to treat directly over the knee, it's recommended to avoid that area because it has that biostimulation effect. So, but other than that, it is completely safe to be used in all ages.
Interesting. Now, if I want to do MLS laser, and obviously you don't treat people directly these days, where can I go get MLS laser?
So the best thing to do is to go on our website, healwithlaser.com.au, and we're the exclusive distributors in Australia and New Zealand. So we distribute to medical practitioners and clinics. So the best thing to do would be jump on our website and you can find a clinic closest to you that offers it. And if they don't offer it, ask them. I think this is something that it needs to be accessible to everybody. This is, I used to say it was the future of healing. It's healing. It's
He said that to me day one. He said, this is the future of healing. I was like, yeah, I've heard that before. But I think I am a believer in it because I have seen that results firsthand.
Yeah.
If I was going to go do laser, how can I find a doctor, and how do doctors react to you talking about MLS laser? Are they open to it, or are they skeptics of laser?
I'm so glad you asked me that question, because most are very open simply because it's based on photobiomodulation and they get it. Photobiomodulation is scientifically proven. We know it works. It exists. It's available to us. And I guess it all comes down to using the safest device that we want to make sure that it works. So with MLS laser, it's a medical device. It's, like I said, it's a European MDR approved. It's TGA approved. It's FDA approved. Yeah. We have people all around the world using it, and there are medical practitioners and professionals that are using this device and this technology it's delivering remarkable results. We have, a mixture of surgeons. We have GPs. There are physios, chiros, podiatrists. There's a sports therapists, a big range of practitioners using it in everyday life for professional athletes, in the sports world, diabetics for open wounds, in, like I said, cancer care. So I think it's a technology that should be available more than it is in Australia. We're a little bit behind.
I think there's only a few doctors in Melbourne that actually use it, I believe. Is that correct?
There's a handful. There are more, I would say, chiros and physios using it. There's only a handful of surgeons using it at the moment as part of their perioperative care, which is amazing. That's what we want. But it's one of those things that it needs to be, this is what I'm here for. This
is your job. Just kind of to spread the word of MLS laser, and you're doing a great job of it.
Yeah, thanks.
And could I use it daily if I wanted to, or do you recommend time apart? So maybe 2 or 3 days apart from each treatment?
At least a day in between, at least 24 hours in between, just to allow that healing response to occur. So it's like if you injure yourself and you have that inflammation, you would allow 24 to 48 hours of inflammation to occur because of the body's natural healing anti-inflammatory response. Yeah. So it's the same with laser. More is not always best. So if I were to deliver two protocols, one after the other at the same time, you're not going to get any more benefit, because once the cells have absorbed the energy and the correct dosage, that's it. They've absorbed it, and then you let it take its course.
So anyone listening to this that has an injury, what advice would you give them?
My advice is to ask your practitioner or your physio or your doctor to use the MLS laser, and not only are you speeding up healing and accelerating your repair and your recovery, but you can avoid medication completely, opioid dependency. Yeah. And MLS has proven to reduce that significantly. To see that reduction globally it's very promising. Yeah. It's exciting. Yeah. We have this technology available to us, and we're not using it enough. And it's just a matter of time, hopefully, that Australia does catch up with the rest of the world to be able to use this technology. So in treatments, it's suggested, MLS is recommended to use every 2 to 3 days, potentially up to 3 times a week. Yep. So in acute injuries, you would use it up to 8 treatments. And with chronic, you would require a little bit more, so probably up to 10, 12 treatments. Yep. But after the first treatment, you'll notice significant results, whether it's pain relief or usually people report that they feel, you would remember that you felt a little bit like less tension in the area.
No, I felt definitely less pain and less inflammation for sure. and I was able to get back to exercising much quicker. It didn't heal the injury because I've got a meniscus tear, so I'm not going to say it did, but it definitely improved it.
Okay.
Yeah.
So how many treatments did we do?
We did 6.
Okay.
I think you stiffed me on the last 6.
Was that it?
Yeah, we did 6. But I was 6 in 2 weeks, and I definitely saw an improvement.
Yeah, excellent. Were you training in between?
Yeah. Yeah, I was.
Yeah.
Yeah, so I'm the worst patient. No, 'cause I don't let it rest. I exercise, and I'm the worst.
That's okay. Look, I think, it's important to note that we need answers that don't require downtime. We're such a busy population.
Yeah.
No one wants downtime. MLS, yes, it's going to work faster if you rest more and let that process happen. But we, in the perfect world, that's achievable. But the reality is that not everyone has time to have downtime. So we want quick recovery.
Yeah.
And MLS offers that quick recovery, and you will eventually achieve that fast recovery compared to not using MLS laser. If you were to recover naturally or recover with medication, it's proven that MLS laser accelerates that healing. It's evidence-based medicine, which is now evidence-based practice.
Like I said, I've seen it before. I'm a massive fan. So, Lissa, thank you for the chat.
Thank you.
And hopefully you can keep healing more people.
Thank you so much. Thank you for having me.
Cheers.
Thanks.